Hello everyone, today we will talk about an important subject. It is what's the difference between SIRS, sepsis and septic shock. Before everything, we need to know what is bacteremia. It means that there is bacteria in the blood. We can know that by making a blood culture. What about SIRS, which is the abbreviation of systemic inflammatory response syndrome? Systemic inflammatory response syndrome is defined by the presence of two or more of these criteria. First, the person has temperature more than 38 Celsius or less than 36. Second, there is heart rate more than 100 beats per minute. Third, there is respiratory rate more than 20 per minute. Fourth, there is white blood cell count more than 12,000 or less than 4,000. Five, there is disturbed consciousness or hyperglycemia in the absence of diabetes. So the presence of two or more of these is the diagnosis of systemic inflammatory response syndrome. What is sepsis? When do I say this patient has sepsis? I say that patient has sepsis when there is systemic inflammatory response syndrome associated with bacteremia. So there is bacteria in the blood and there is systemic inflammatory response syndrome to those bacteria. That means this patient has sepsis. What about septic shock? I say this patient has septic shock when there is sepsis plus low blood pressure that cannot be corrected by only administration of a fluid. So the patient may need drug in order to correct the blood pressure and maintain mean arterial pressure above 65 millimeter mercury. So this is the difference between bacteremia, systemic inflammatory response syndrome, sepsis, and septic shock.